Hi, my name is Aglavani and I'm going to give an introduction about a purpose of developing strategies in tackling job discrimination issue in our healthcare industry. Okay, to begin with is to promote ethical practices. Okay, to support this, strategies ensure adherence to core ethical principles such as fairness, equality, and also respect for all the individuals includes staff and patients. Okay, following by that, strategies also enhance workforce diversity by attract and retrain the diverse of talented workforce by contributing to a richer work environment. Besides that, by developing strategies also will improve patients' outcomes. This shows a non-discriminatory and collaborative healthcare industry fosters a good and improved communication, empathy, and ultimately higher quality patients care. Last but not least, mitigating legal and reputational risk along with building a positive organizational culture of inclusion and belonging also serves several purposes about the developing strategy in job discrimination issue. Thank you.
Common discrimination issue in the healthcare industry in Malaysia. I have listed six of these common discrimination issue. The first one is gender discrimination, which is focused on women. It has impact on patient and also the professional. As for the patient, women patient, especially from the marginalized communities, may face bias in accessing reproductive health care or other specialized treatment. And for the professional female healthcare workers, they may face unequal pay, limited promotion opportunity, and also they might have gender bias in leadership roles. Second one is ethnic and racial discrimination. This one is also has impact for the patient and also professional. For patients, certain ethnic minorities such as indigenous community or refugees may encounter language barrier, cultural insensitivity, or unequal access to the healthcare service. For the professional, ethnic minorities in the healthcare workforce may face biases that limit their career progresses or create a hostile work environment. The third one is discrimination based on the socio-economic status, which patients from low-income background they might receive lower quality care or a bad quality care or face they will face stigmatization for being unable to afford the private health care. Public healthcare facilities often serving lower income group may be overburdened, leading to delay and compromised care. The fourth one is disability discrimination. This one, accessibility challenges in the healthcare facility. It can prevent person with disabilities from receiving an appropriate care. Healthcare provider may have a lack in training to address the need of this patient with physical, sensory, or intellectual disability. Next one is age discrimination. This one, it has impact on the patient and also the professional also. As for the patient, elderly patient may be deprioritized or face assumption that their health issues are inevitable due to their age, leading to inadequate treatment. For the professional, a younger healthcare worker might face stereotyping as they will say the older colleague is more competent than the younger one. The last one is language and communication barrier. Patients who do not speak the dominant language, for example, migrant worker or foreign resident, they might struggle to access care or communicate effectively with the healthcare provider.
Good evening, everyone. My name is Yan Yi. You can call me Anne. I'm from Group 4. Now, let's look at the ethical implications of job discriminations in the hospital setting. First of all, discriminations directly violate the professional ethic that healthcare workers are expected to uphold, especially the principle of duty of care, justice, and respect. Every employee, regardless of their background, deserves fair treatment and equal opportunities. If staff members are discriminated against based on gender, race, age, or other personal traits, it creates an environment that is unfair and unjust. Secondly, discrimination doesn't just affect individuals, it damages the entire team dynamics. In a hospital, teamwork is critical to delivering effective patient care. If there's bias or favoritism, trust breaks down among the team. This can lower morale, reduce collaborations, and ultimately impact patient safety and outcomes. Let me share a real example. In 2021, a hospital in the US faced a lawsuit because a qualified African American nurse was repeatedly passed over for promotion in favor of less experienced white colleagues. The nurse eventually left due to emotional stress, and the hospital's reputation suffered significantly after the case gained media attention. This situation shows how discrimination was lead to lawsuits, damage a hospital public image, and even put its accreditations at risk. In short, discrimination not only breaks ethical codes, it creates long-term damage to both employees and the hospital's reputations. That's why it's so important to take action early. Now, let's pass to my next group member. Thanks.
Strategy to tackle discrimination at hospital. First of all, implement comprehensive anti-discrimination policies. Hospital must establish and enforce clear policies that define and prohibit all forms of discrimination, including systemic racism, implicit bias, and microaggression. These policies should outline unacceptable behaviors, provide examples and detailed procedure of accountability. Second is training and education on equality, diversity, and inclusion (EDI). Regular and mandatory training program on EDI can help healthcare professionals recognize their own bias and understand the impact of discrimination on patient care. These sessions should include case studies, role-play scenarios, and evidence-based strategy to foster inclusive behavior. Utilize equality dashboards. Equality dashboards are valuable tools to tracking and analyzing disparities in healthcare delivery. By monitoring the patient care outcome based on race, ethnicity, gender identity, social economic status, and other factors, healthcare institutions can identify gaps and implement targeted intervention in real time. Third strategy is promote diversity in clinical trial. Ensuring the inclusion of underrepresented population in clinic research is critical for producing generalizable and equitable healthcare solution. Hospitals should partner with communities, address barrier to participation, and design culturally sensitive recruitment strategy to improve diversity in trial. Last strategy is establishing safe and confidential reporting mechanism. Creating a safe environment for reporting discriminator incident is essential. Hospitals should implement confidential system that allow staff, patient, and families report concerns without fear of retaliation. This mechanism must ensure privacy, offer support, resource, and include transparent follow-up procedure.
Hello everyone, I'm Logisri Satyasilan and I would like to talk about the conclusion. Job discrimination in healthcare threatens the core values of compassion, equality, and professionalism that the industry stands for. Ethically, it is imperative to treat all healthcare workers with fairness, dignity, and respect. Strategically, organizations must foster inclusive cultures through unbiased recruitment, diversity training, transparent career development, and equitable leadership opportunities. Implementing strong anti-discrimination policies, continuous education, and accountability systems are key solutions that will not only protect workers' rights but also enhance collaboration, morale, and quality of patient care. By confronting discrimination head-on, we take a vital step toward building a more just, diverse, and an effective healthcare system for both providers and patients alike. Thank you.